your kidneys.
Yeah. What are some of the problems that can happen if you have continued high blood pressure?
Well, with continued high blood pressure, it's varied things. You can have issues with your heart, obviously. You can also have strokes. If it's uncontrolled, you'll have a big burst in your brain. There's only so much that the veins can handle with the pumping of the blood with a lot of pressure on it, and you can certainly have a stroke. The heart will get very weak because the more pressure you're putting on the heart to pump out, the more the heart is working, and the harder it works, the floppier it's going to get, and eventually it can lead to congestive heart failure, which will lead to also pulmonary problems. And in conjunction with diabetes, it's just like a perfect disaster recipe, because you'll have problems with, if you've got a lot of pressure, you'll have very little very little blood running to your extremities, little blood running to your kidneys and everything else. With diabetes and blood pressure together, you can wind up with amputations, with erectile dysfunction, which a lot of people aren't very keen on, blindness because of the problems with the eyes and what happens with the sugars and all the vessels that just basically die in your eyes, and it's just a slew of things. You can have intestinal problems, the liver gets fat, and eventually you've got the cholesterol issues, and it's just it's one bad thing that just leads to 50 other really bad things, and that's just a small smidget of what can actually happen.
Is there anything specific that can happen to women who have high blood pressure?
It depends. If you're pregnant, you can have a lot of issues with pregnancies and hypertension. Sometimes hypertension occurs during pregnancy, and that has to be taken care of in the hospital and stuff like that. Usually people have to have babies right away, but in women altogether, where heart disease is really climbing up there with like the reasons for our deaths. So it's similar to men. It's similar to men in that effect, especially with the strokes and the heart attacks and all of that stuff. And again, the heart becomes very floppy and it doesn't pump hard enough, and it just doesn't have enough force to pump out when there's so much pressure against it. So again, congestive heart failure, pulmonary problems, strokes, and sometimes you have little mini strokes in the eyes. The blood vessels burst in your eyes, and it's just, again, it's a slew of things, which is basically the same as men, but women don't really take as much care of themselves as men do. Women complain less, guys go more to the doctor and stuff, but it's about similar things.
And the last question is, what actually causes high blood pressure?
Well, that's a big question. It could be, number one, genetic. It could always be genetic. Some people are skinny as a rail, 110 pounds, and they have huge blood pressures. That could be issues with the kidneys. The kidneys aren't giving the correct hormones that they're supposed to be giving, so your blood pressure is going to be elevated, and you just have to correct it with medications. Other reasons would be, of course, cholesterol and plaque that is all over the vessels, which is basically making a hose that's nice and open much more closed, right? So then when you're pushing fluid against the hose that's very closed up, what's going to happen is you're going to have your heart working extra hard to pump blood in a very teeny tiny hole. So that's really where it starts. And again, it's also a dietary issue: cholesterol, obesity, and genetics. Definitely genetics. A lot to do with genetics. Yeah.
I'm sorry. One more. I just
Absolutely.
remembered.
Go ahead.
What does the numbers mean? The systolic and the
diastolic?
Yes.
The systolic number means that's when the heart pumps the blood. There's a valve, and it's the aortic valve, and it pushes it open. And depending on how hard you have to push on that valve, that's the systolic number. That's like how much your heart has to work in order to pump blood out into the vessels. The diastolic number is how much work the heart has to do, or the blood has to do, to push back down into the vessels, into the heart, returning from the rest of the body. So it all depends on how much constriction is going on, or how tight your vessels are on the outside of the heart, and then it depends on how much pressure there is. That's how the systolic number will be higher or lower. Me, I don't have blood pressure issues, so it's very easy for the heart to just go ploop, stuff goes through through, comes back, normal numbers. You know, my mom is like, you know, she's a Hispanic woman, she's short, she's fat, cholesterol, diabetes, hypertension, the whole gamut. So for her, it's like, you know, the heart's like, ah, and it's got to like, you know, do this and push really hard. So that number, the first number, which shows that the heart's pushing against the forces, that means you have a lot of blood pressure, high blood pressure. So it all depends on the length and the width and all that stuff of the vessels.
And I'm sure that cholesterol will make it even worse.
Of course, because cholesterol causes plaques and plaque buildup in the vessels, and that's what causes this, you know. So even in the carotids and these arteries that go up here, if there's a lot of cholesterol plaque built in there, people have strokes from hypertension. Sometimes there's so much plaque that's actually like stuck inside of all the vessels that when the blood goes right through, it takes a piece of plaque along with it, it takes a piece of plaque, it travels, and it can cause an embolus or some sort of a problem in the heart. That can cause a heart attack if it travels to your head. It can block an artery or a vein or something like that, and that can cause a stroke. So there's so many different problems with like blood pressures and with cholesterol combined and diabetes. You know, it's the trifecta of death.
Okay.
Oh my God, thank you so much.
Yeah, I hope I explained a little bit, something.
Oh, you explained more than
Yeah?
enough.
Well,
Thank
good.
you so much.
Let's just give the sucker a try. Now that I got you all excited, it'll probably be all high.
Okay.
Oh yeah, they have it. Like I got a pen?
Yeah. Because I got abilities to move things around sometimes. Because I just do it.
Yeah.
I'm just looking for your
Tent over
radial
there, we
pulse,
can always
okay?
shift around. We can also do something with us to move around, where you can move over. Your partner of ours. So
It's going to be a little high because the cuff is
screen
too
the education material. You can use our education material for continuity. So what do you want to do?
sorry.
Do you have high blood pressure?
Yes, I'm diabetic.
Do you take any medication this morning?
Yes.
Are you taking this morning?
But I haven't eaten.
Okay. So because again the cuff is too small for you, then this blood pressure gave me like 182 over 98, which I'm sure is not your blood pressure. Usually when you get the correct cuff size, the number will go down at least like by like another 30 or something, like some points like that. But this is way too big for you. So another thing you have to tell your friends, family, people that you know is when you go to the doctor, don't, you know, make sure that the cuff isn't too small or too big for you, because then you'll get a wrong reading. The cuff has to fit very perfectly around your arm so that you can actually do something like this, really nice and comfortable, so it can puff, you know, be puffed up correctly. If the cuff, when they put it on you, is like this,
Yes.
that's indicative of a bad cuff size. You need a larger size so that you can get the correct blood pressure. So just make sure that, you know, you educate your friends, your family, whomever is like, you know, following you on your blog. Make sure that the cuff size is right. Make sure that the person who's doing the blood pressure readings is not just, you know, of course, nurses, nurse aides and all that stuff, but they've been retrained every year on to, you know, correctly do things, because there are changes every year on how you should and shouldn't do blood pressures. So, you know, they have to be educated and keep educating their staff, the doctors, on how to do it. And if you have any doubts, just ask the doctor, hey, do you mind taking the blood pressure again? I'm sure they're not going to say no.
Okay, thank
Got
you
it?
so much.
My pleasure.